We will give about 10 to 30 seconds for guests to join the meeting. All right. Good afternoon. My name is Alani Kioki. I'm the Executive Officer of the board. Welcome to the Hawaii Medical Board's virtual and in-person board meeting. Before the board meeting is called to order, we will play a short video to explain the procedures for this hybrid meeting and how members of the public can participate and interact with the board during this meeting.
Welcome to the Professional and Vocational Licensing Virtual Board Meeting.
When the meeting begins momentarily, the chair will take a roll call, explain any specific rules for this particular board, and then move to public comment. The name of the board member will appear on the bottom left-hand corner of your screen. For instance, this is board member Y, and this is board member E. Public testimony will be accepted at the beginning of the meeting and before each agenda item. You can indicate that you are ready to testify by clicking on the Raise Hand button being circled by the mouse on your screen now. At the appropriate time, the board will recognize you to speak and ask you to unmute your mic as shown here. Again, public testimony will be accepted at the beginning of the meeting and before each agenda item. Public attendees will not be able to unmute their microphone until recognized by the board. Public attendees who are recognized to testify will be asked to identify themselves by name and their affiliated organization if applicable. Please mute your microphone when you are finished speaking as a courtesy to others and members of the board. Public attendees will not be able to unmute themselves after the testimony is completed unless recognized again after raising their hand. At some point during the meeting, the board may choose to move into executive session. When the board moves into executive session, the board members' microphones and video feeds will be turned off, and a similar screen as you see now will be displayed. When the board returns from executive session, their microphones will be turned on as well as their video cameras.
Welcome again to the Professional and Vocational Licensing Virtual Board Meeting.
At this time, the chair will call the meeting to order and take a roll call, as well as explain any additional rules that may be specific to this board.
So, good afternoon. And to view the meeting and provide oral testimony, please use the link at the top of your agenda. You will be asked to enter your name, and the board requests that you enter your full name, but you may use a pseudonym or other identifier if you wish to remain anonymous. You will also be asked for an email address, and you may fill this in with any entry in the typical email format. For example, your username followed by the @ sign, followed by the email domain, generally .com. Your microphone will be automatically muted. When the chairperson asks for public testimony, you may click the raise hand button that's found on your Zoom screen to indicate that you wish to testify about a particular agenda item. The chairperson will individually enable each testifier to unmute their microphone. When recognized by the chairperson, please unmute your microphone before speaking and mute your microphone after you finish speaking. For phone access, if you cannot gain internet access, you may use audio-only access by calling the Zoom phone number that's also listed at the top of your agenda. Upon dialing the number, you'll be prompted to enter the meeting ID, which is also listed at the top of your agenda. And after entering the meeting ID, you'll be asked to either enter your panelist number or wait to be admitted into the meeting. Note that you will not have a panelist number, so please wait until you're admitted into the meeting. When the chairperson asks for public testimony, you may indicate you want to testify by entering the star sign and then the number 9 on your phone's keypad. After entering the star sign and the number 9, a voice prompt will let you know that the host of the meeting has been notified. When recognized by the chairperson, you may unmute yourself by pressing the star sign and the number 6 on your phone. A voice prompt will let you know that you are unmuted. Once you are finished speaking, please enter the star sign, followed by the number 6 again to mute yourself. For both internet and phone access, when testifying, you'll be asked to identify yourself and any organization that you represent, if any, again, and each testifier will be limited to 5 minutes of testimony per agenda item. If for any reason connection to the meeting is lost for more than 30 minutes, the meeting will be continued on a specified date and time, and the information will be posted on the board's website. And instructions to attend the State of Hawaii virtual board meetings may also be found online at the board's website as well. So at this time, I'd like to call the meeting to order, and I will be taking a roll call. So I'm Danny Takanishi, Oahu member, and I'm present and alone. And also please let me know if you're also alone. Mr. Gary Belcher, our Vice Chair.
Present and alone.
Dr. Franklin Dao.
Present and alone.
Dr. Rick Fong.
Present and alone.
Dr. Elizabeth Ignacio.
Present and alone.
Dr. Michael Jaffe.
Present and alone.
Dr. Angela Pratt.
Present and alone.
Dr. Jerry Young.
Present and alone.
And I'm just checking that I don't believe that I missed anybody who's on the meeting currently. Okay, so now that the meeting is called to order, the first order of business is the approval of the minutes. And so I will take them together unless any of you decide that you want to extract anything. So if I can entertain a motion as noted on the agenda to approve the minutes of the meetings that you see listed. The October 12th, 2023 executive session minutes, the December 14th, 2023 executive session minutes, the January 8th, 2024 open session and executive session minutes. So if I may entertain a motion.
Pratt, I move.
Okay, thank you.
Chair Takanishi, I don't believe we've received the executive session minutes for October 12th and December 14th or January 18th. We only have the January 18th open session minutes, if I'm
That is
correct.
correct. You are correct.
Okay, thank you for that point of order. So if we can amend the motion to only approve that one set of minutes. May I enter?
I move.
Okay, thank you. Is there a second?
Second.
Okay, thank you, Dr. Young. Any further questions? Okay, all those in favor, please raise your hands. Okay, okay. Dr. Fong, are you?
I'm going to abstain as I wasn't present.
Okay, so we'll do a roll call because it's not unanimous. Danny Takanishi, I approve. Mr. Gary Belcher.
Approve.
Dr. Franklin Dao.
Approve.
Dr. Elizabeth Ignacio.
Approve.
Dr. Michael Jaffe.
Approve.
Dr. Angela Pratt.
Approve.
And Dr. Jerry Young.
Approve.
Okay, so at this time, I'd like to ask if there's any public testimony for any of the items on the agenda, but I'll also open it up to public testimony as the agenda items do arise within the context of this meeting. And then I would also like to qualify that statement by saying that if any individuals have either applications or adjudicatory matters that are before the board on this agenda, that if you'd like to provide public testimony, you may, but otherwise we will invite you in to the appropriate either adjudicatory or executive session when those are in.
Thank you, Chair. This is Johnny. We do not have anyone requesting to provide testimony.
Okay, all right, thank you. So I would now like to recess and enter into adjudicatory session. Yes, Dr. Ignacio.
I apologize, but I cannot find my Teams link for executive session. So I wanted to ask Alani if you guys could please resend it to me. I'm sorry.
Okay, sure, we'll do that. But in the meantime, we'll go ahead and we'll recess into adjudicatory session. So if all can mute their microphones and turn off their videos in Zoom, and we'll reconvene in adjudicatory session in Teams. And Dr. Ignacio, I believe they will send you the link.
You know, I don't know if I'm in Zoom or Teams.
You just need to, you need to unmute yourself, Dr. Young.
I thought I did. Before we switched, I could see both things.
You guys are unmuting in
Now,
Zoom.
I'm gonna have to ask them to resend it or something.
I
I can't get my video to start.
Okay, but we can hear you okay.
Thank you.
Okay, so we're back in open session. And so I'm just gonna take a quick roll call. Danny Takanishi, I'm present. Mr. Gary Belcher,
Present.
Dr. Franklin Dow,
Present.
Dr. Rick Fong,
He's trying to sign out and sign back in.
okay, all right, Dr. Elizabeth Ignacio,
Present.
Dr. Michael Jaffe,
Present.
Dr. Angela Pratt,
Present.
and Dr. Jerry Young.
Present.
Okay, all right, so if I can entertain a motion to enter into executive session.
This is
Chair
Frank.
Takanishi, would you like to announce the results of the adjudicatory matter before we go into executive session?
I'll do it all at the same time.
Okay.
I think we have a fair amount to potentially discuss in executive session.
So this is Frank. I move, we move into executive session.
Okay, all right, is there a second?
Jaffe, second.
Okay, any discussion? Okay, there being none, I'll take a roll call because I'm not sure if Dr. Fong was able to sign in. So Danny Takanishi, I vote yes. Dr. Franklin Dow,
Yes.
okay, Mr. Gary Belcher.
Yes.
Dr. Rick Fong, are you able to give us a verbal? Okay,
In
Dr.
open
Elizabeth.
session, all members' cameras do have to be on.
I am here, present.
Okay, all right, Dr. Ignacio,
Yes.
Dr. Jaffe,
Yes.
Dr. Pratt,
Yes.
and Dr. Jerry Young.
Yes.
Okay, so we'll now enter into executive session. So please turn off your microphones and your video.
Dr. Parham, we sent you a link to join the Microsoft Teams meeting, to join the executive session. Please check your email. Thank you. Dr. Shah, please check your email for a Microsoft Teams link to join the executive session. Thank you. Dr. Shah, please check your email for a Microsoft Teams link to join the executive session. Thank you.
Okay, welcome back everybody to open session. And so I'm going to take a quick roll call and let me know just for the record that you're present and you're alone. Danny Takanishi, Oahu member, present. Mr. Gary Belcher,
Present and alone.
Dr. Franklin Dow,
Present and alone.
Dr. Rick Fong,
Present and alone.
Dr. Elizabeth Ignacio,
Present and alone.
Dr. Michael Jaffe,
Present and alone.
Mr. Mike Wesley Munn,
Present and alone.
Dr. Angela Pratt,
Present and alone.
and Dr. Jerry Young.
Present and alone.
Did I miss anyone? All right, and just as a matter of record, in the adjudicatory matter of Dr. Stephen W. Powell, the board had voted during adjudicatory session to approve the settlement agreement. Okay, so now we'll move on to the application. So the first is the physician application by endorsement, the matter of Dr. Andrea Jean Nelson. So if I can entertain a motion.
I move to approve Dr. Nelson's application, provided she submit a revised, non-endorsed application with an accompanying letter of with an accompanying non-disciplinary letter of education.
Okay. Is there a second to the motion?
I second. This is Frank.
Okay. Is there any comment or questions on the part of the board? Any public testimony?
Thank you, Chair. We do not have anyone requesting to provide testimony.
Okay, thank you. Okay, so the motion is on the floor. All those in favor of the motion, please raise your hands. Okay, it being unanimous, I will not take a roll call. So on the matter of application of Dr. Carlos Parham seeking for the waiver of the attempts at the USMLE Step 3 and for sponsorship for further examination. If I can entertain a motion.
This is Gary Belcher. I move that we approve the sponsorship of Dr. Parham to take USMLE Step 3.
Is there a second?
Jaffe second.
Okay. Any comments or questions from the board members? Any public testimony?
Thank you, Chair. We do not have anyone requesting to provide testimony.
Okay, all right, thank you. Okay, all those in favor of that motion to approve the sponsorship, please raise your hands. Okay. All right. So I'm gonna have to take a roll call. Myself, Danny Takanishi, I vote nay. Mr. Gary Belcher.
Yes.
Okay. Dr. Franklin Dow.
Yes.
Dr. Rick Fong.
No.
Okay. Dr. Elizabeth Ignacio.
Yes.
Dr. Michael Jaffe.
Yes.
Mr. Wesley Munn.
Yes.
Dr. Angela Pratt.
Yes.
And Dr. Jerry Young.
Yes.
Okay, the motion passes. Okay, on the matter of the application of Dr. Fizal Shah.
This is Elizabeth Ignacio, and I move to defer decision making pending that with the consent of applicant Dr. Shah, that we review the summary from the University Hospital of New Jersey, the internal investigation from incident of 2020.
Okay, is there a second to the motion?
Second, Dr. Young.
Okay, any further questions or discussion? Any public testimony?
Thank you, Chair. We do not have anyone requesting to provide testimony.
Okay, all right, so the motion is on the floor. All those in favor of the motion, please raise your hands. Okay, it passes unanimously, so I will not take a roll call. All right, so we're going to move on to item number 5 for the legislative session. And so before I move into this, any public testimony or comments from the public?
Thank you, Chair. We do not have anyone requesting to provide testimony.
Okay, all right, thank you. All right, so moving into the current bills that we have.
I apologize, Chair.
Yes.
Mr. Belcher is raising his hand.
Oh, I'm sorry, Mr. Belcher.
I just wanted to have you ask for a motion regarding the ratification list.
Oh, okay. We'll go ahead. Can I have a motion to approve the ratification list?
Belcher, motion to approve.
Okay, is there a second?
Jaffe, second.
Okay, so moved and seconded. Any further discussion? Okay, all those in favor, please raise your hands. Okay, all right, thank you. It passes. Okay, so moving on to the legislative sessions. And I believe I did ask, there's no public testimony on these. So starting out with we have a series of bills before us, and hopefully we can make it through this. But the first one has to do with and it should be within the packet, the annual report on findings from the Hawaii Physician Workforce Assessment Project, which is the first on that. And so that bill is for informational purposes only. So please stop me if any of you have any comments, questions, or concerns that you'd like to raise, because I'll try to move through these so that we can get through the business at hand. The second has to do with the healthcare preceptor tax credit and the Preceptor Credit Assurance Committee. And that's HB 82 HD1. And so that had been at the last meeting, the board had decided to track that bill. Is there any change in the board's sentiment? Okay, moving on. The general excise tax exemption for medical services for physicians in advanced practice nursing. And at the January 18th meeting, it's noted that this measure was similar to a Senate Bill 761, which the board had decided to track. Any comments, concerns, or questions? Okay. On the matter of HB 510, the abortion survivors, that bill, the board had voted. And I believe this one was historically where the board had concerns on this. Any comments or questions from the board?
Dr. Jaffe.
Dr. Jaffe?
You're muted.
I would like to hear what Dr. Dow feels and has to say about this, since he's an expert in this field, please.
Well, thank you, Dr. Jaffe. I think the wordings are quite vague, and we would have to be very careful in terms of what constitute medically appropriate and reasonable life-saving, and at which gestational age are we talking about here? Because there's certain age that has very abysmal outcome, leading to resources that are spent that could have been used for other gestational age. That's my concern.
Okay. Any other comments?
I don't see any, but Chair, would you like me to move through the list for you? Would
Yeah.
that be easier?
Uh-huh.
Okay. So just to clarify, House Bill 510 relating to children, in the past, at its February 9th, 2023 meeting, the board voted to oppose this measure. Is, just for my clarification, is the board's position, are they going to remain the same? Are you going to remain the same in opposition? By consensus, a nod, anything? Yes, okay,
Yeah.
Thank you. House Bill 664 relating to health authorizes physician assistants to sign orders for respiratory therapy and plans of care, expands the class of healthcare providers under whom respiratory therapists may practice respiratory therapy care to include physician assistants and plans. At the February 9th, 2023 meeting, the board supported this measure. Please note that Senate Bill 599, which was its companion, passed out and has been enacted into law. House Bill 666, House Draft 1, Interstate Medical Licensure Compact. This is a carryover. The companion bill, Senate Bill 674, was passed out and enacted and will take effect January 1st, 2025. House Bill 685, relating to abortion, prohibits the abortion of a fetus that contains a fetal heartbeat, provides certain exceptions, establishes penalties. This is a carryover measure. At its February 9th, 2023 meeting, the board voted to oppose this measure. Is the board's position the same? Okay. House Bill 1275, relating to prohibiting chemical abortions. Relating to abortions, prohibiting chemical abortions, drugs for abortions as specified, providing exceptions, providing a criminal penalty for violating the prohibition on use of chemical abortion drugs for abortions, providing definitions, specifying exceptions, and making conforming amendments. At your February 9th, 2023 meeting, the board voted by consensus to oppose this measure. Is your position the same? Thank you. House Bill 1332, relating to the termination of pregnancy, prohibits the abortion of a fetus that is capable of feeling pain, prohibits abortions by dismemberment, provides certain exceptions, establishes penalties. This is also a carryover measure. In its February 9th, 2023 meeting, the board voted by consensus to oppose this measure. The same? Thank you. House Bill 1428, relating to healthcare, prohibits the state from denying or interfering with the patient's right to choose to obtain an abortion or to terminate a pregnancy if the termination is necessary to protect the life or health of the patient, repeals a criminal penalty for violations of certain abortion provisions, clarifies that physicians, osteopathic physicians, and APRNs may administer medication abortion via telehealth for a patient residing in the state. This is also a carryover measure. The board supported a similar measure, Senate Bill 1, in 2023. Given that this is similar to that bill, will the board continue to support this measure? Okay, thank you. House Bill 2079, relating to health, relaxes the requirements for prescribing certain controlled substances as part of the gender-affirming healthcare services, expands the protections established under Act 2, Session Laws of Hawaii 2023 to include gender-affirming healthcare services, clarifies jurisdiction under the Uniform Child Custody Jurisdiction Enforcement Act for cases involving children who obtain gender-affirming healthcare services. The companion bill is Senate Bill 2882. A position may be needed. It amends in Section 6 of the bill of House Draft 1, it amends 453-8, which is your disciplinary provision. Position? For similar measures, which expanded certain protections, the board has voted typically in favor or in support of these types of measures.
I'm in support.
Thank you.
Yeah.
Is that by consensus? Okay, thank you very much. House Bill 2156, let's see. I believe the board at its last meeting voted to track this measure. You okay with that? House Bill 1675, relating to the general excise tax. Past legislation, the board voted to track measures similar to this. Is that okay to continue to do so? Thank you. And my screen just froze. So Randy, sorry, will you be able to take over? Oh, maybe not. That's okay. I'm sorry, did I leave off at House Bill 1675?
That was the last one, yeah.
Thank you very much. Senate Bill 17, relating to medical informed consent. At your February 11th, 2021 meeting, the board opposed a similar measure, House Bill 138 and Senate Bill 203. A 2023 meeting, the board also opposed this measure because your current administrative rules provide specific information dealing with informed consent. And this was mandated by Act 114 in 2003. Will the board continue to oppose this measure or take a different position? Oppose. Thank you. Senate Bill 60, relating to health, authorizes state licensed and credentialed physicians, APRNs, and physician assistants who are not physically in the state to issue prescriptions for certain controlled substances under a limited circumstance, authorizes pharmacies to dispense the prescriptions. In 2023, you voted to track it at your most recent meeting. In January, you also voted to track.
So this is the bill that Mr. Belcher referred to.
Yes. Will your position remain the same, and that's to track the measure? Okay, thank you. Senate Bill 61, relating to associate physicians. It creates a new category of professional licensure for associate physicians. So these are the physicians who have not got into an accredited residency yet. In 2018 and 2019, the board opposed similar measures as this. At your meeting in February 9th, 2023, the board voted to submit testimony appreciating the intent of the measure, but expressing similar concerns as you did in March 2018 regarding House Bill 1813, House Draft 2, and again in January 2019, House Bill 39. At this same meeting, in February 2023, the board supported Senate Concurrent Resolution 4, which would have the state auditors study the probable effects of the regulatory measure and address whether its enactment is consistent with the policies of HRS Chapter 26H. So you appreciated the intent, expressed your concerns, and was more supportive of the concurrent resolution, which would analyze the program. You're okay with that?
And then if I can just interject just for informational purposes, the Federation of State Medical Boards is working collaboratively with members or representatives of the ACGME to look at how to address issues related to physician workforce. And the intent, of course, is that this will be looked at in terms of multidisciplinary healthcare. So not just in terms of physicians, but in terms of other members of a healthcare team, for example, that can provide care for patients in a way that will respect public safety. So there's going to be more to come on this within the next year at a national level.
So we should track it?
So I think we can take the same perspective that we have at this point, because I'm actually not sure where this is going to go. Right now, when I click on the link, there's no testimony, no hearing scheduled at this point in time. So I think tracking it would be reasonable.
Danny, this is Jerry. I had a question about associate physicians. You know, recently I'd actually heard of this happening, but I'm pretty old and I couldn't recall back in my day, if you managed to finish an American medical school, you always got a residency somewhere. And is this because of the hospitalist movement that there are not enough positions, or why is this happening?
Yeah, well, I think just in terms of the statistics, what's happened is there have been more and more medical schools that have been accredited, but the residency positions have been the bottleneck, so to speak, in part because of the Balanced Budget Act that had been passed way back in 1996, 1997 for funding. And so that's changed recently in terms of the federal government looking at, you know, on an application basis, you know, potentially increasing those opportunities. But at the same time, what's happened is there's also been an influx of international physicians who would like to work in the United States for a number of reasons. So there's been a series of different variables that have basically affected this. And so the long and the short is there's many reasons why there's individuals who have not been you know, able to successfully obtain a residency position. And so this was just a mechanism. The state of Missouri had actually looked at that with the Missouri Medical Board creating a separate path for licensure for these individuals who essentially work under preceptors. But again, the Federation is working with the ACGME on this, and they're going to include other constituency groups. And really, the overarching goal is to see if, you know, what is the best model using the available workforce in a very safe and responsible way. So there's going to be more to come on this. But I think as stands, if the board's, you know, history has been to oppose such a bill, then I think it would be reasonable for the board to maintain that position until which time there's additional data. So thoughts from the board? Stay with the approach that the board has adopted previously? Okay, all right.
Was it outright oppose, or was it appreciate the intent with or comments or something? I couldn't remember what we had said. We oppose, but we appreciate the spirit of like.
That's right. So basically it's, you know, appreciate the spirit and the intent of the bill, but basically oppose but support the state auditor to study the potential regulatory effects.
Thanks. Sorry, I just confused.
Shall I go on?
Yes.
Okay, thank you. Senate Bill 62 SD2 HD1 relating to medical education and training. Danny, I believe you had recused yourself from this discussion.
Yes, and I will continue to.
Thank you. At the January 18th, 2024 meeting last month, if the bill is heard, the board voted to submit testimony appreciating the intent of this measure. However, it would defer to the University of Hawaii regarding its budget priorities. Same
position.
Thank you very much. Senate Bill 131 relating to female genital mutilation. At your most recent meeting in January, the board voted to track this measure. However, I would like to point out that while this measure does not amend HRS Chapter 453, it does require that a healthcare professional, including physicians, physician assistants, and physicians in training, make an oral report of female genital mutilation. Within 24 hours, a written report shall be made. Failure to do so will cause the person to be found guilty of a petty misdemeanor. On page 6 of the bill, subsection 3, it provides that any healthcare provider licensed pursuant to Chapter 453, your chapter, who performs the procedures described in subsection 1A shall not be subject to criminal liability if the procedure is within the scope of practice of the person's license and qualifications, medically necessary, or performed on a person who is in labor or who has just given birth. So there's the part where you could be found guilty of a petty misdemeanor. However, if you are practicing within your scope of practice and are licensed and meet all of those other provisions, you'll be fine. You want to take a position, you want to continue to track.
Lonnie, is that what it said, or was it only specific to labor and delivery and gynecological practices?
So if you look at page 6, subsection 3 of the measure, 1A, it says it shall not be subject to criminal liability if the procedure is within the scope of the person's license and qualifications, medically necessary, or performed on a person who is in labor or who has just given birth.
I really
Dr.
don't.
Dow?
I
I would
really
say
don't.
we should just monitor.
I agree.
Thank you.
What did
We
Dr.
will
Dow
do-
say? I couldn't hear what you said.
Monitor.
Okay, track. Okay,
I'm sorry, good track.
all right.
Thank you. Senate Bill 169 relating to health requires Medicaid and private insurance coverage of ambulance services, authorized Medicaid programs, and requires private insurers to cover community paramedicine services rendered statewide by emergency medical technicians or paramedics. So this is being brought to you because you regulate the practice of emergency medical personnel. However, at the January 18th, 2024 meeting, you voted to track this measure. Also note that community paramedicine is regulated by the Department of Health under HRS Chapter 46. So this particular group of emergency medical personnel are regulated by DOH. Okay, so track.
Mm-hmm. Yep.
Thank you. Senate Bill 233, you voted to track in January. Senate Bill 254 relating to the termination of pregnancy. At the February 9th, 2023 meeting, the board voted to oppose this measure. At your most recent meeting, you voted to track it. Would you like to oppose or would you like to track?
Dr. Jaffe, pose.
Dr. Dow opposed.
Okay. I don't think we need
So-
to take a formal vote. I see other heads nodding.
Okay, thank you. Senate Bill 319 SD1 recognition or relating to the recognition of emergency medical services personnel licensure interstate compact. So in March of 2023, the board submitted testimony before the Ways and Means Committee, appreciating the intent of the measure and offering comments. The board noted its appreciation that the measure created a working group to determine the feasibility and the effects of the state adopting the compact, but also noted that the board's concerns regarding the compact as outlined in its testimony before another committee remain the same. So you had some concerns regarding enforcement, the constitutional aspects of the compact itself, and your inability to actually vet the candidate. You also had some concerns regarding, I believe, revenue. So given those concerns, the board was unsure whether a working group can address its concerns because you can't change compact language. Same position?
Mhm.
Okay, thank you. Senate Bill 442 relating to health. This is one of the Our Care, Our Choice Act bills. You guys have consistently tracked these types of measures. We're okay?
Mhm.
Thank you. Senate Bill 64 relating to health prohibits state and county employees and officers from providing reproductive health care services, patient information, or expending state resources in furtherance of another state's investigation or proceeding that seeks to impose civil, criminal, or professional liability upon a person or entity related to reproductive health care services. Prohibits any person from being compelled to provide reproductive healthcare services, patient information, prohibits any persons from being disqualified from licensure or subject to disciplinary by the Hawaii Board of Professional Licensure for providing reproductive healthcare services. At the February 9th, 2023 meeting, this is a carryover measure. The board voted to support this measure.
And we should,
Good.
I mean, it has to do with the board.
Thank you. Senate Bill 684 relating to telephonic services. This is a carryover measure in 2023. The board tracked this measure. Tracked?
Mhm.
Thank you.
Yep.
Senate Bill 757 relating to emergency medical services requires the Department of Health to establish and implement a program to improve and increase support for emergency medical services in the state, requires DOH to submit report to the legislature. Similar measures in 2023, you voted to track. Would you like to continue to track these measures? Thank you. Senate Bill 761 relating to retention of healthcare providers. Beginning July 1st, it provides a general excise tax exemption for medical services performed by healthcare providers. In January of this year, you voted to track this measure.
Mhm.
Okay. Senate Bill 870 relating to healthcare providers. What does this do? It prohibits hospital and healthcare facilities to permit or require healthcare providers to provide services for any period after the healthcare provider has been on duty for 16 consecutive hours of an aggregate of 80 hours during any period of 7 consecutive days until the healthcare provider takes at least 10 consecutive hours of time off duty. So in January, you voted to track this measure. In past legislative sessions, you also voted to track these measures. You also recommended that the professional associations possibly follow these measures. So I believe last year I reached out to the executive director. Senate Bill 890, this is a carryover measure. This is similar to the bill, Senate Bill 604. In 2023, supported similar measures. Would you like to continue to support? Thank you. Senate Bill 896, Senate Draft 1. These are all kind of very similar measures regarding reproductive rights. In February 2023, the board supported this measure. At your most recent meeting, you also supported this measure. Good? Thank you. Senate Bill 919 relating to workers' compensation. In January, you voted to track this measure. Senate Bill 955 relating to medical care for minors. House Bill 482, its companion. This is a carryover measure. In February 2023, you voted to track this measure. And most recently in your January meeting, you also voted to track this measure. Good. Senate Bill 1038, Senate Draft 2, relating to telehealth. This is a carryover measure. House Bill 693 is its companion. At your January 18th, 24 meeting, you voted to track this measure. I believe the same decision was made in 2023 as well. Senate Bill 1167, Senate Draft 1. This is a carryover measure. Proposes a constitutional amendment to protect an individual's reproductive freedom in their most intimate decisions, including the right to abortion and to contraceptives. In February of last year, the board voted to support Senate Bill 1528, which is a very similar measure to this measure. Would you like to be consistent with that decision? Or, okay, thank you. Senate Bill 1215, Senate Draft 2, House Draft 1, relating to healthcare preceptors. Its companion, House Bill 1450. This is a carryover measure. The board voted to track this measure last month. Senate Bill 1380, Senate Draft 1, relating to medical cannabis. The board voted to track this measure last month. Senate Bill 1395, Uniform Controlled Substance Act, relating to the Uniform Controlled Substances Act. Its companion, House Bill 1097. This is a carryover measure. At your meeting in January, you voted to track this measure. Senate Bill 1396, relating to the Uniform Controlled Substance Act. Did I just say this? House Bill 1098, sorry. In January, you voted to track these measures. Senate Bill 1397, its companion HB 1099. This is a carryover measure. It's relating to the electronic prescription accountability system. At your January meeting, you voted to track this measure. So for the next two measures, we will need a position. These are carryover measures. Senate Bill 1491, relating to reproductive health care services, prohibits, with certain exceptions, any state or political subdivision from providing private information regarding or authorizing an arrest warrant based on the receipt or provision of or assistance with reproductive health care services that are lawful in the state. It requires the Department of Health to maintain on its website information about access to abortion in this state, including current information about state law. It requires the director of DCCA to assess and report to the legislature on any policy changes or legislation needed to ensure that no person is disqualified from licensure subject to professional discipline based on the lawful receipt or provision of or assistance with reproductive healthcare services in the state. I'm not sure why I couldn't find it in your minutes, but would you like to track, support, oppose, appreciate the intent, offer comments?
I mean, the only reason why it's potentially pertinent to the board is because it has DCCA in it.
Yes.
But really, when I think about the board's scope of practice, I don't see that there's a whole lot of impact on it. So I'm wondering if this should be a track.
Really up to you all.
Mm-hmm. What's the wisdom of the board?
Does this go into HIPAA compliance?
Well, you can't, no matter what we passed, the state law cannot trump HIPAA.
Okay.
I mean, you know how it works, right? It's not going
Right.
to stand up in court.
Right.
Mm-hmm.
It just seems like this bill is something that it's talking about increasing information between entities, and that we've supported the other bills that are consummate with this. So I'm not sure if tracking, it seems like it's something we should support. It's
But
always easy
but
to
again,
punt.
I think HIPAA, HIPAA covers this. I think like Dr. Dahl mentioned, so. Thoughts on the rest of the group?
In the previous measure from last year that was enacted into law, the SB1, it seems like it covers similar ground in terms of provider protections. And the only difference that I can see from the description is the reporting, requiring the director to report that, anything, any other related, what does it say? Any policy changes or legislation. So like kind of like a surveillance mode for DCCA. And I guess the only question I would have is the capacity for them to do that. But I think in terms of the intent, we can support because it is in line with the SB1 of last year.
Mm-hmm.
Agree.
So by consensus, appreciate the intent.
Mm-hmm. Mm-hmm.
Okay, thank you. Senate Bill 1503 relating to health prohibits certain boards from taking adverse action against individuals possessing or applying for a license to practice medicine and surgery or nursing, from providing abortion care services or gender affirming treatments. This is a carryover measure. This is similar to all of the other measures you discussed. So I'm assuming you're supportive?
Mm-hmm.
Yes. Okay, thank you. Senate Bill 1526 relating to reproductive health care explicitly provides that a patient has a right to choose to obtain an abortion. This is a carryover measure. It's companion House Bill 1441. The board at your February 2023 meeting supported this measure. We're okay? Senate Bill 1528 amends the Hawaii State Constitution to prohibit the state from denying or interfering with an individual's reproductive freedom, including the right to choose or obtain an abortion. The board supported this measure, which is a carryover last year. Okay. Senate Bill 2117 relating to healthcare preceptors. Again, the board typically tracks these types of measures. Okay. The next two, we do need a position. Senate Bill 2186, relating to healthcare workers, establishes heightened penalties for the assault and terroristic threatening of healthcare workers, clarifies the definition of terroristic threatening to include the methods of contact. Its companion is House Bill 2283. Support, track, oppose, appreciate the intent, and offer comments, or would you like to defer to your professional association?
I mean, I think it would make, to me, this is not the board's scope, but if they need something, wouldn't it make more sense to defer to a professional association? I mean, I personally agree, but again, as a board member, I don't know if this is our kuleana, but the spirit is good. I think the intent is good, but maybe leave it to our association, our HMA. I don't know, thoughts? Mm-hmm.
And I believe, and please correct me if I'm wrong, that the association has always supported measures similar to this.
Mm-hmm.
Yes.
Similarly, Senate Bill 2189 relating to workplace safety. Similar topic, defer to the association. Thank you. So we'll just track these measures then. Senate Bill 2464 relating to healthcare provider credentialing. This authorizes healthcare organizations to accept healthcare providers' credentialings that was conducted by certain healthcare organizations or state agencies, establishes a healthcare credentialing clearinghouse pilot program within the Department of Health declares that the general fund expenditure is exceeded. I believe a draft measure was provided to you sometime last year. This is a Department of Health bill. And at that particular meeting, the board voted to track this measure, which has since been assigned as Senate Bill 2464. You okay with that?
Mhm.
I do need a measure for a position for this. Senate Bill 2669 relating to gender affirming care. This provides certain protections. You okay with, I mean, support, appreciate the intent? Okay. Senate Bill 2807 relating to taxation. It provides tax credits for qualified physicians. The board typically tracks these measures. Senate Bill 2887 relating to insurance. The board generally tracks these measures. Senate Bill 3125 relating to medical care for minors. Its companion, House Bill 2436. I do need a position. It authorizes minors who are 14 years or older to consent to medical care for sexually transmitted infections, pregnancy, and family planning services, including the prevention of sexually transmitted infections. Requires confidentiality policies and practices for insurers and providers. Its companion is House Bill 2436.
I mean, that's not our scope either.
No, it's not. So I just need to know if you would like to track it or do something with it.
We just track it or monitor it.
Yep.
Okay.
Senate Bill 3252, proposing a constitutional amendment to protect right to reproductive freedom. The board in the past has supported similar measures, such as the couple discussed previously. Would you like to support this measure? Thank you. And last one, Senate Bill 3330 relating to health. This establishes a candor process through which patients and their families, healthcare providers, and healthcare facilities can engage in open communication about how an adverse care health incident occurred, how it will be prevented in the future, and what compensation, if any, will be offered to the patient or their family. Establishes notice and confidentiality requirements for open discussions. The companion is House Bill 2775. Would you like to take a position, defer to your professional association, track?
Shall we track?
I agree.
Thank you.
It's kind of not our,
Okay, that's it. Thank you very much.
Okay, thank you for doing that.
legislation.
You saved my voice from reading all of the that column D. I was gonna try and just get through by looking at the first column and the last column. Okay. All right. So again, I'm being mindful of time. So the Federation of State Medical Boards from time to time works on some policies, and these are all going to come up for the approval at the House of Delegates. So usually when they come to the boards, the board of directors of the Federation has already reviewed, edited, blessed it. And so this is one on the reentry to practice. And these are really meant to support medical boards in either decision-making or rule-making to support physicians appropriately. So if you all had a chance to look through this, and so any thoughts or comments, because whatever thoughts or comments that you may have, we'll be sure that it gets forwarded to the Federation. Dr. Jaffe?
So yes, we really appreciate getting this guidance from the Federation. And it's important for us to read through it. I guess my only question is, it brings into question whether, do we have policies in writing for a lot of this stuff? Because it's kind of stating that we should, and I'm not familiar if we do. So I wanted to come up with a quick proposal. I don't want anyone to get upset with me if I said that maybe we need to have an administrative meeting 1 month where we discuss reentry, we discuss policy writing and rewriting questions for our application, and perhaps a newsletter. Something that other states are doing that it's very hard to squeeze into our workload, but if we had a separate meeting administratively, we might be able to hammer some of this out. That would be good for us to have, I think, unless it's on file and I just don't know about it.
Yeah, so we don't have any policies, but we have, from time to time, use policies that the Federation has developed. Because remember, the Federation, what they do is and you look in the back, it has all the people that are involved, and they come from various boards, they come from the actual board itself. But we don't have our own policies per se, because we basically fall back on HRS and Hawaii administrative rules. But certainly, I think that in terms of our own rulemaking that goes through a whole administrative process, we have depended on what's put out by the Federation. So that's one piece. Historically, long ago, there used to be a newsletter that would come out, I think, at least once a year. And I think, but part of the challenge has been the availability of staff. And so, so I think that's good, because I was on the work group for physician impairment that suggested changing questions that medical boards ask. And those are in line with, medical associations, the AMA, et cetera. So, maybe I should open this onto comments from the staff, because Alani's workload is pretty extensive. Now there's, Randy on board, but again, it'll take time, and there was a period of time. Alani was the big administrative officer over all the boards at one point, if I understood correctly. So, Alani, would you like to comment on that?
So if I can just address the newsletter issue, you are correct, Dr. Jaffe. We did have a newsletter for the Board of Medical Examiners before they changed the name. We did have to stop producing that because of legal reasons. So it was determined, with the advice of the Attorney General's office, that we will no longer be issuing or publishing a newsletter. So that's one thing. With regard to creating a policy meeting, the board is subject to sunshine law open meetings. So if you guys hold another meeting that includes more than 2 members, it'll have to be noticed. That means we file it with or post it to the state calendar. We file it with the Lieutenant Governor's office. So you have to consider those things. The boards can create permitted interaction groups. So keep it under quorum, have a very specific reason why you're meeting. For instance, amending the questions, re-entry, things like that. But those topics have to be on an agenda, discussed, and we have to establish why the permitted interaction group will be meeting. So you have to stay within those confines. So these are considerations. Maybe we can consider those types of things after the legislative session. And now that there are 2 of us, I think the workload will be a little more balanced.
Okay, so those are, great suggestions. So any specific thoughts or comments on this particular draft of the reentry to practice? I mean, I thought it was pretty well written. Dr. Ignacio?
I think it's great that they have specific recommendations for us that we can use, so that hopefully I would agree to have like another meeting where we can address it and consider accepting all of these recommendations into our policy or protocol for reentry. And also had a question that if and when we change these or make these policies, do we have to submit that to the legislature or the state somehow in terms of posting it or having someone else vote on it? I was just curious how it works.
Yeah, there's a administrative process, and it has to undergo review from our, our attorney general representative and stuff. So there is a process, and the thing is, and so one cautionary thing is at the same time, if we end up making too many policies, it might bind us, as you can tell
Right.
some of the other questions that we get asked. And so I think, the key thing is what a lot of boards do. It's true that some have their own policies, but what many do is actually they'll just extract the work that the Federation has already done in a lot of these areas. Because even, for example, the work group on physician impairment took representatives like the president, for example, of the Federation of State Physician Health Programs, took in, the leadership, president-elect and secretary of Assam, for example. So they make sure that, and then randomly chose people from different medical boards across the United States geography, just to make sure there was broad input. And then it goes out for a comment to the medical boards. Then, what happens is then it has to go to the House of Delegates for ratification. So almost like things that the AMA does. And they do it on behalf of all their medical associations. And Hawaii has 2 delegates, for example. It's sort of the same process that they go through. But again, it doesn't bind, it doesn't bind the boards, just like what the AMA doesn't bind the Hawaii Medical Association, but it's good guidance. So maybe I think after the legislative session, we can keep this on a back burner until after that's done. Okay, Mr. Belcher?
I was just going to mention that on our license by endorsement application, we do ask applicants if they've been in practice, I believe, in 2 of the last 5 years. Maybe that question could be modified a little bit so that people who were in clinical practice in year 1 and 2, but not in years 3, 4, and 5, could at least be flagged for consideration of re-entry requirements. Just a thought. Maybe that could be discussed at a future administrative meeting.
Okay, that's great. All right. Any other comments on this? Because I'd like to at least get through number 7. And then we can table number 8 for future discussion. But number 7, I'd like to at least get through because I think they're looking for responses. Okay, so anything further on this reentry to practice draft for the Federation for input? Okay, so moving on to item number 7, the correspondence. We have about 13 minutes left. So the first one is an email from Dr. Peter Geisler asking, as you can see, I won't read the agenda because that's already been noticed. So first of all, before I enter into these, is there any public testimony on any of these 3 items under agenda item 7, A, B, and C? Any public testimony?
Thank you, Chair. We do not have anyone requesting to provide testimony.
Okay, all right, thank you. Okay, so we'll start off with 7A then. So all of you had the opportunity to read this packet. And so perhaps maybe to expedite things, if I could just entertain a motion, and we'll treat these as action items.
Belcher, motion to defer answering this question until we have more information about the actual practice rights per statute of the Christian Scientists.
Okay, is there a second to the motion?
This is Frank, I second.
Okay, moved and seconded. Any further discussion? And if I could add maybe,
Question.
sure, Dr. Ignacio.
I thought that we had considered both stating the statute for scope of practice of medicine and also asking for more information. I just, for clarification, want to know what if I thought it was going to be a twofold type of
Okay.
possible response.
So I guess for consideration, does the board want to consider basically stating that our statutes require that anyone who engages in our defined scope of practice seek a medical license in the state, first of all, and then should the requester for information desire to pursue this any further, to provide the board with additional information specifically related to what this individual actually intends to do in the opening of a quote wound healing clinic in Hawaii. And I think the third part may be to consider requesting that staff pursue research to see what prior legislation may exist that's pertinent to this, and bring it to a future board meeting. What are
If
the
that's
thoughts
a
of the
motion,
committee?
I second it.
Okay, so both Mr. Belcher and Dr. Jaffe, would you like to retract your original motion? Because that was moved and seconded.
Okay, I retract my original motion. Would like to see a motion along the lines of what Dr. Takanishi just described.
Okay. And Dr. Jaffe, are you seconding that? Okay, I'm sorry, I think you're muted.
I think it was Dr. Dow. I didn't second Dr. Belcher's.
Oh, okay, Dr. Dow.
Yes, I would second.
Okay, all right, any further discussion on that? Thank you, Dr. Ignacio. Any further discussion? Okay, all those in favor, please raise your hands. Okay, it's unanimous as I can see, so we won't take a roll call. The second one is an email inquiry from Krupa Patel, as you can see, requesting clarification on items that appear to be much more relevant to the Board of Pharmacy. So perhaps to expedite this, if I can entertain a motion to forward the request to the Board of Pharmacy for the Board of Pharmacy to provide a response.
Ignacio, so moved.
Okay, thank you. Is there a second?
Second, Frank.
Okay, thank you. Any further discussion? Okay, all those in favor, please raise your hand. Okay, thank you. It passes unanimously. And finally, the final correspondence 7C. This is on the matter of inquiry from Jared Rainey. If I can entertain a motion for that request.
Jaffe, that I think I move that we support the current HRS laws that describe prescribing controlled substances must be provided by an initial in-person consultation.
Pratt, second.
Okay, any further discussion on this? Okay, so just I think for some clarity, I think it sounds as though the motion then is to note that under Hawaii revised statutes, in response to the question, that the interpretation requires that a Hawaii licensed physician must be physically present within the state and prescribe this, or must prescribe this in an in-person context. Am I understanding the motion correctly? Okay. And this is also in part to acknowledge the role that the Department of Law Enforcement has in enforcing statutes related to the prescribing of controlled substances. So I'm just clarifying that I understand the motion on the floor.
Yes, clarified.
Okay, all right, thank you. Any further discussion on this? Okay, all those in favor, please raise your hand. Okay, it passes unanimously. So in the 6 minutes that we have left, I think that we'll defer. I'll take the prerogative of the chair because I think it'll be another rich discussion. I'd like to defer discussion on item number 8. And just to be sure, Mr. Belcher, our vice chair, was there anything that I missed going through our agenda today?
No, you covered everything, Chair Takanishi. Thank you.
Okay, and so I just want to check because we have a few minutes left. Deputy Attorney General Wong, I just saw you on the video. Was there a comment that you'd wanted to make?
I was just going to say that, for item 7C, did you want to address, his points, point by point? For number 1, you would say the medical board is not the authority for interpreting chapter 329. And that would also apply to his question number 3. And I don't know if you would want to raise, he's trying to argue face-to-face versus in-person. I recall something about physical exam that the board had said it involved touching the patient. Is that correct?
So maybe I think what we should do in the few minutes we have left is I think since there is some there are some questions here being raised by our Deputy Attorney General. Perhaps maybe our approach should be to vacate the vote that we just took.
No, you're fine. I just don't know if you want to, flesh out the details and drill down a little bit, but what the motion was is fine. And I can work with Alani on a response on the more detailed answers, if that's okay.
Okay. Is the board fine with that?
I agree with that because sometimes we're not touching the patient. We're just having a conversation in the exam room.
Yeah. Okay.
Okay, thank you.
All right. So any further discussion on this? Because I do want to get to number 9. And all of you hopefully had an opportunity. I know we've had this on every meeting for a while now. Any interested volunteers to serve as our second commissioner on the Interstate Medical Licensure Compact Commission? We still have a vacancy.
May I make a recommendation that maybe
Please.
one of the commissioners be one of the executive officers?
That is absolutely within the construct of the commission. Would the board like to make a motion so that becomes an action item that one of the executive officers serve in this capacity?
Randy Hook.
I was just gonna say, this is Gary. I move that we have one executive officer as our second commissioner to be determined by Alani.
Okay, is there a second to that?
Dr. Young,
Okay, all right, any further discussion? Okay, all those in favor, raise your hand. Okay, so it passes unanimously. I will now take a roll call. Okay, so our next meeting, because we have exactly under 2 minutes left before sunshine law requires us to sunset this meeting. So our next meeting is March 7th, 2024. And so reminders will be sent out for both Teams and Zoom in advance of that meeting. And the only item that we will carry over will be item number 8 to discuss that and so that we can actually do due process on that one. So without further ado, it is 4:29 p.m. So any further business before we adjourn? Okay, I'd like to thank all of you. We had a great discussion today and went through a lot of groundwork. So thank you very much, and we'll see you next month. Okay. Bye.
Thanks, Dr. T. Thank you, staff.
Mhm.
Thank you,
Alani.
Lonnie.
Mhm. Thank you.